Ever wonder why cardiovascular health is a topic of urgent concern? It's not just about keeping your heart beating. It's about the entire circulatory system functioning in harmony. Your heart, blood vessels, and the blood itself need to be in optimal condition to ensure every part of your body gets the nourishment it needs. Now think about hypertension, often known as the silent killer. It's like a thief in the night, quietly damaging your cardiovascular system, raising the risk of heart disease and stroke. When blood pressure is high, the heart works overtime, causing the walls of the arteries to harden and narrow. Imagine a highway congested with traffic, causing stress and potential accidents. That's what happens when hypertension is left unchecked. The repercussions can be severe, leading to heart attacks, kidney disease, and even blindness. It's not a fate anyone should face. That's why we have anti-hypertensive agents, critical warriors in the fight against high blood pressure. Taking a step back in time, let us explore the advent of anti-hypertensive agents. Our journey begins in the mid-20th century, an era when heart disease was rapidly emerging as a major health concern. As medical science advanced, the need for a solution to the mounting problem of high blood pressure became evident. Enter anti-hypertensive agents, the game-changing drugs designed to combat high blood pressure and protect the heart. In the early days, these agents were a novelty. The first of their kind, anti-hypertensive agents were greeted with a mix of skepticism and curiosity by the medical community. Their humble beginnings can be traced back to the discovery of a class of drugs known as diuretics in the 1950s. Diuretics, by promoting the elimination of salt and water from the body, were found to have a beneficial effect on blood pressure. However, the journey was not all smooth sailing. The early anti-hypertensive agents were often associated with a range of side effects, and their effectiveness in preventing complications of high blood pressure was not immediately recognized. It took years of rigorous research, testing, and refining before they took their place as a mainstay of cardiovascular therapy. As the years rolled on, the landscape of anti-hypertensive agents began to change. The 1970s and 80s saw the introduction of beta blockers and ACE inhibitors, respectively, each offering a new approach to blood pressure control. These agents represented significant advancements in the field, not just in terms of their effectiveness, but also in their safety profiles and ease of use. The medical community began to embrace these agents, recognizing their potential to change the lives of millions of people living with high blood pressure. Doctors started prescribing them more frequently, and patients began to see real improvements in their health. And thus, the journey of anti-hypertensive agents began. A journey that has evolved remarkably over the years. From their humble beginnings to their current status as indispensable tools in the fight against heart disease, anti-hypertensive agents have truly made their mark on medical history. As science advanced, so did our understanding of hypertension and its treatment. The evolution of anti-hypertensive agents is truly a testament to the power of human ingenuity and perseverance. In the early days, the treatment of hypertension was limited to a few classes of drugs, such as diuretics and beta blockers. Diuretics, also known as water pills, work by helping the kidneys get rid of unneeded water and salt from the body into the urine, thus reducing blood volume and pressure. Beta blockers, on the other hand, reduce the heart rate and lessen the heart's workload, thereby lowering blood pressure. As we moved into the latter part of the 20th century, the introduction of new classes of drugs further revolutionized the treatment landscape. Calcium channel blockers emerged, which relax and widen the blood vessels by preventing calcium from entering the smooth muscle cells of the heart and arteries. Angiotensin-converting enzyme inhibitors, or ACE inhibitors, then came into the picture, blocking the formation of a hormone that causes blood vessels to narrow. In the 21st century, we've seen even more advancements. For instance, angiotensin II receptor blockers, or ARBs, were developed. These drugs block the action of angiotensin, a chemical in the body that narrows blood vessels. Beyond the introduction of new classes, there have also been significant improvements in the mechanisms of action of these drugs. More precise targeting of specific biochemical pathways, enhanced delivery methods, and better understanding of individual patient characteristics have all contributed to the creation of more effective and safer anti-hypertensive agents. Innovations have also been made in the realm of combination therapies. Using two or more drugs in conjunction allows for lower doses of each, which reduces side effects and improves patient adherence to treatment plans. This continuous evolution has led to the development of more effective and safer anti-hypertensive agents. The journey is far from over, though. As we continue to deepen our understanding of hypertension, we can expect even more advancements in the future. Fast forward to the present, we now have a plethora of anti-hypertensive agents at our disposal. Today's medical landscape is teeming with a diverse range of these agents, each designed to combat hypertension in its own unique way. Let's begin with the diuretics. These are often the first line of defense in treating hypertension. They help your kidneys expel more sodium and water, which reduces blood volume and brings down blood pressure. Next, we have the beta blockers. These drugs work by slowing down your heart rate and reducing its workload, effectively lowering the pressure exerted on your arteries. The third class we'll discuss is the ACE inhibitors. They prevent the formation of a hormone called angiotensin II, which is known to narrow blood vessels. By blocking its formation, these drugs help the vessels relax and widen, thus lowering blood pressure. Then there are the calcium channel blockers. They stop calcium from entering the cells of your heart and arteries. This leads to a reduction in heart rate and a relaxation of the blood vessels, thereby reducing blood pressure. Another class of modern anti-hypertensive agents includes the angiotensin II receptor blockers. These drugs block the effects of angiotensin II, allowing blood vessels to widen. Lastly, we have the alpha blockers. They reduce nerve impulses to blood vessels, which allows blood to pass more easily, causing blood pressure to decrease. These classes of anti-hypertensive agents are not used indiscriminately. Each patient's individual circumstances, such as their specific type of hypertension, overall health, and other existing conditions, are taken into account when deciding the most suitable course of treatment. In some cases, a single drug may not be sufficient, and a combination of drugs from different classes may be used. This strategy not only increases the effectiveness of treatment, but also helps to minimize side effects. Modern anti-hypertensive agents are a testament to human ingenuity and perseverance in the face of health challenges. They show us how far we've come in our understanding of the human body and our ability to manipulate its processes to improve health outcomes. What does the future hold for anti-hypertensive agents? This is a question that's being explored by countless researchers around the world, and the possibilities they're uncovering are as fascinating as they are promising. In the field of cardiovascular medicine, the future of anti-hypertensive agents lies in the realm of personalized medicine. This approach aims to tailor treatment strategies to the individual patient, considering their unique genetic makeup, lifestyle, and other factors. This could potentially lead to the development of more precise and effective anti-hypertensive therapies, reducing side effects and improving patient outcomes. There's also a great deal of interest in the area of drug delivery systems. Researchers are exploring innovative ways to deliver anti-hypertensive agents directly to the affected areas of the body, increasing their efficacy while reducing systemic side effects. Imagine a world where your medication knows exactly where to go, like a GPS-guided missile targeting only the diseased tissues. One other promising avenue of research lies in the development of new drug classes. For example, scientists are investigating the role of certain enzymes and proteins in hypertension, with the hope of designing drugs that can target these specific molecules. These novel agents could offer new therapeutic options for patients who are resistant to current treatments. And let's not forget the potential of technology and digital health. Wearable devices that monitor blood pressure in real time could provide valuable data for adjusting medication dosages, while machine learning algorithms could help predict which patients are at risk of developing hypertension, allowing for early intervention. So, as we gaze into the future, we see a landscape filled with potential. A future where anti-hypertensive therapy is not just about managing a condition, but about optimizing health. A future where treatment is as unique as the individual receiving it. A future where technology and medicine intertwine to create a seamless, patient-centered approach to care. Indeed, the future of anti-hypertensive agents is as exciting as it is hopeful. Let's keep our fingers crossed and our eyes on the horizon, for the advancements to come promise a world where hypertension is not a chronic condition, but a manageable one. In summary, the journey of anti-hypertensive agents is a fascinating tale of scientific progress. These drugs, born out of necessity and advanced through innovation, play a critical role in maintaining cardiovascular health. They've evolved from rudimentary concoctions to sophisticated medications, each generation more effective and safer than the last. We started with the dawn of anti-hypertensive agents, a time of discovery and exploration. We then traced the evolution and advancements, witnessing the remarkable strides in medical technology and understanding. In the modern era, we've seen a variety of anti-hypertensive agents, each tailored to the unique needs of patients. We also glimpsed into the future, where personalized medicine and genetic engineering promise even more effective treatments. These agents don't just manage hypertension, they save lives, prevent strokes, and keep hearts healthy. It's a testament to human ingenuity and our relentless pursuit of better health. If you're as intrigued by this journey as we are, subscribe for more because you won't find me later. Until next time, keep learning and stay healthy.